Hi, welcome to The Reluctant Patient. This is episode 6, Learning and Communication. I'm changing tack this time and speaking directly to medical professionals, and I would encourage my regular audience to follow along as we'll be discussing adult education, which is a very important topic given the amount of information that patients must learn in a very, very short period of time. I come to you not only as a prostate cancer survivor, but also as an adult education expert. For the past 34 years of my career, I've been directly involved in building training departments, training programs, writing courseware, developing curriculum, and coaching young trainers. Along the way, on my own prostate cancer journey, through diagnosis and treatment and recovery, I made some observations, and it occurred to me that I might be able to share some information that I have that will help you as a professional communicate more effectively, get more information into the patient's head. As far as patients go, I think it's really important to understand how you learn and to advocate for that and to insist for learning to occur in a way that's most effective for you. So I'd like to talk about a few concepts related to adult education. There are plenty of competing philosophies and methodologies with regard to adult education, but for the past several decades, most academic institutions have embraced the concept that adults learn in different ways. Most institutions accept that we have different learning styles. Secondly, most adults are a blend of learning styles. It's not just one. Most people embody all learning styles, but some are more emphasized than others. And then finally, the most interesting finding is that adults intuitively know how they learn. And so a lot of times the philosophy in adult education training is set a buffet table and hand your learners a plate and just let them scoop up what they need. That sounds a little loosey-goosey, but it's actually a very effective training style. As a medical professional, I'm sure you're under the gun all the time. You do not have time to develop curriculum for your patients. So I just want to key you into a few concepts that can help you broaden your concept of learning and possibly accommodate that learning process with your patients. So let's get started and talk about learning styles. These learning styles may vary depending on who's advocating for them, which institution, which university. They may define them slightly differently. I'm going to go with a very common one. So we're going to come up with a set of 4 learning styles. Number 1 is conceptual learning. Number 2 is didactic learning. Number 3 is transference learning. And finally, number 4 is creative learning. So we'll talk about these. Number 1 is conceptual learning, and a large subset of conceptual learning is visual learning. This is big picture learning. This is high altitude learning. This is understanding where you're starting and where you're planning to end and the path that gets you from beginning to end. Just the basics, the big picture. When you hear a patient say, what does this look like, or what's the big picture, that may very well be an indication that they respond very well to images, to illustrations. They may respond well to broad fundamental statements, introducing them to very, very broad concepts and terminology. These are the people who want to see the high altitude stuff first before they continue. I have that tendency in myself. I'm sure you do too. But I've been in classes where they start talking about something, and I'll sit there and wave my hand in the back and say, wait a minute, before you start, what are we trying to do here? What's the objective here? And if you have someone who's saying something like that, then they're appealing to conceptual learning, and the best way to help them out is to give them a link to watch an animation, or give them a flow chart, or give them a photograph to help them understand their world. Number 2 is didactic learning. And in some ways, this could possibly be the easiest learning style to administer. And when I think of didactic learning, I think of a recipe. A recipe will include a list of ingredients, and then 1, 2, 3 will give you instructions. Number 1, set the oven to 350 degrees. Number 2, mix your dry ingredients, and so on. You go down this list. You don't need the big picture. You know you're baking a cake, and so you just need the numbers, the facts. So if you have a patient who is saying, do you have a list? Or can you just give me the facts? Or just tell me what to do? If you're hearing those kinds of things, that is an ask for didactic learning. And I just think it's very, very interesting. I had a boss one time and sit there and say, why are you going through all this elaborate stuff to create training? All you need to do is create a list of 5 things and tell me how to do it in 5 steps. And my response to him is, that works well for you, John, but that is a learning style, and it doesn't work well for everybody. But we always include that didactic part in any of our training because it does appeal to certain people, and I just want to get to that. Number 3 is transference learning. And maybe we should call it analogous learning. You're looking for analogies or metaphors. If someone speaks in metaphors, or asks for metaphors, that might be an example of them seeking that out. I'm sure you use it in your own practice. I can just imagine someone saying, you're sending someone for a PSMA PET scan, and they say, what's that like? Well, one way to respond to that is, oh, well, I see you've already had an MRI. Well, it's a lot like an MRI. You're going to be laid on a table, you're going to be slid into a machine. Fortunately, the PET scan machine looks like a giant tuning fork. It's not as claustrophobic as the MRI tube. But you give them a starting place, and you just transfer that information into their current situation, and you don't have to start over. They already have an inkling, and you just kind of moving forward in the future. You're dealing with transference learning when you have someone say, what is that like? They're asking for an analogy. They're asking what that's equivalent to. They're asking to transfer something they already know into a current state. So consider that. Finally, we're talking about creative learners, which from a trainer's perspective is the most difficult and challenging type of learner. And it's also, surprisingly, I think one of the most effective learning styles ultimately in the end. And this is when your patient or the person who's learning drives the learning experience, and you will recognize them right away because they will interrupt you, and they'll stop you, and they'll ask for a definition, or they'll ask for a citation, or they'll ask for more information at a certain point. Where can I read more about this? This is someone who usually creative learners, and I like to think of creative learners, I like to use the term self-directed learning. I think that's a clearer term for us to understand, someone who directs their own learning experience. But I find that they also are very immersive in their learning. They will really, really, really dive in deep and absorb as much information as they possibly can. So if someone asks you for links to the internet because they want to read more, they're probably a creative learner. If they cut you off, which is rude, and I understand that, they're doing it because they want to go in a very specific angle. And you can trust that. Sometimes you need a patient to sit still and listen specifically to what you're saying. But a lot of times you need to trust where they're going with stuff. It may seem like a crooked road they're going down, but they know their own mind, and they're filling in the information as they need. So these are the 4 learning styles. And as I mentioned before, most people are a combination of these learning styles. As a patient, it's really important to recognize what you're asking for. When you say something, you're actually sort of saying how you learn and how you want this information. Do you have a diagram of this? Just give me the facts. Wait a minute, let me stop you there. All of these things speak to how you learn. And when you're aware of that, I think you have more confidence in advocating for that, insisting on this. If you're rebuffed the first time, you can sit there and say, look, doc, I really need to know more. You're going to have to give me some resources. Or, look, doc, I just don't want to do some deep reading. Can you give me just a few paragraphs? Can you give me an illustration? And really stick to your guns, because if you're asking that, then you know something about how you learn, and that's the most effective way for you to get started in your learning experience. A couple other things that I imagine that I can think of that are worth discussing as someone who's conveying information to another. This comes up a lot with trainers. One of them is what I call the deer in the headlights. And this happens quite frequently. You'll be in a class and someone will ask a question and your answer will be, oh, well, all you have to do is this, this, and this, and you're all set. And as soon as you start doing this, you may see an expression as something like this. When you see that expression, which I call deer in the headlights, it means that they've just shut down. They have been overwhelmed with the instructions you're giving them. I think the way it would play out, likely in a doctor's office, is you have a patient who's eager to learn. Well, I want to know everything about my disease. What can I do? And you may respond by saying, oh, there are a couple brochures in the lobby that you definitely want to pick up because they have some links to websites that are also very useful. And there's some websites you can go to. You can always go out to Harvard Edu and get legitimate and safe information, reliable information, and you give them all these sort of different sort of resources out there, and their eyes glaze over and they're doing this. And when you see that look, you can pretty much guarantee they're going to walk out of your office and they're not going to do anything just because they don't know where to start. A lot of people, if you tell them what to read and what to do, they will do that, but they don't know how to get started. They do not know how to direct themselves through that process. So if you see that reaction from them, my recommendation would be that you stop and say, okay, wait a minute. We're going to meet again in a week. So in this next week, I want you to do these 3 things. And literally dictate to them what you want them to do. I want you to go out and watch this brief video on this website. I want you to go here and read this piece in this brochure. So you can give a few instructions and say, when we come back next time, we're going to talk about what you've learned so far, and then we'll move forward. You don't have to be totally in charge of their learning process, but if you can just get them started, if you can just break it down into a few small steps that are digestible, that are executable on their part, then you can kind of get the wheels moving and you can kind of get them in the right direction, and they can move forward. For patients who interrupt, it's something to think about. It's rude behavior, and it's disruptive to what you're trying to convey to them. But if someone's disrupting, it's worth asking yourself the question, are they just ADHD? Are they just jerks? Or are they trying to slow you down a little bit so they can digest the information that they're receiving? Or are they trying to change channels because intuitively they know that where they need to go is over here to learn a little bit more? So I would just ask you to be a little bit patient with interruption and ask yourself what that might be about, because it might be more than just someone who doesn't have good manners. And then another scenario that I can imagine, this happens all the time when we're teaching classes, is someone gets way off base. They start asking questions that are not pertinent at all. They're in another universe, and they're asking all sorts of crazy stuff. And you sit there and say, come on back, little sheep, come on back. And you want to kind of give them the right place. So, if you're dealing with a patient who's asking questions that you think are entirely impertinent, I would really encourage you not to dismiss their questions. I would encourage you to answer the question. Here's an example of how you could possibly deal with a situation like this, which is, I hear your question, and I have an answer for it. But before we start with that answer, I just want to encourage you to look over here instead. Because if you focus your time and your thought and your energy over here, this is going to be much more worthwhile for your recovery process or for your treatment process. So take a look at these things. Now I'll answer your question. And when you do that, you're doing several things. You are respecting the patient, you're respecting the question that they ask, which is important, and you're redirecting them. And because you have respected them, you've built up some credibility with them. You've said, I respect you enough that I'm going to give you an answer to your question, and while we're at it, let me talk to you, and let's talk about thinking about things over here, because this is going to be really useful for you. If you do that, you're much more likely to get a patient who complies with you, who agrees with you, who works cooperatively with you. So I would encourage you to think about that as well. So by listening carefully, you might be able to pick up on some cues that inform you as to the best way to deliver information to a patient. So I encourage you to just listen carefully and consider the different ways that you can approach the communication and education process. As for prostate cancer patients, really encourage you to have a sense of how you learn and what you need. What kind of information you need from healthcare professionals, and stick to your guns and really ask for it. You can do that politely, but sometimes it needs persistence. Sometimes someone will say, well, you don't need to know that, or, well, this will do just fine. And sometimes you need to talk back and say, I do need more research. I'm a grown-up and I can do this. Or saying, I need this in a different form. I need to see a chart or a graph or an illustration, and stick to your guns about that. Thank you very much for your time, and as always, be good to yourself.